In honor of Poison Prevention Week, which is coming up March 16th through 22nd, 2025, this is my annual poison prevention episode. The topic this year is poison prevention in older adults. And I've got two returning guests today. They are poison prevention educators Angel Bivens, RPH, from the Maryland Poison Center, and Dr. Wendy Stephan from the Florida Poison Information Center in Miami, Florida. Welcome to the Pharmacist's Voice podcast, episode 321. I'm your host, Kim Newlove. I'm a pharmacist by training with experience in hospital, retail, compounding, and behavioral health. But I have also done some volunteering around the topic of poison prevention education. I used to go into elementary schools and talk to fifth graders, and also during career day presentations, I would talk to the older kids, the big kids in high school as well. I absolutely love poisoning prevention as a topic. You can make a big difference by talking to a small group for a short period of time. You can find the show notes for this episode on thepharmacistvoice.com. Click the podcast tab and then find episode 321. As I publish this episode on Friday, March 14th, 2025, National Poison Prevention Week starts on Sunday, March 16th. That's in 2 days. The theme is When the Unexpected Happens, Poison Help is Here for You. Again, the theme is When the Unexpected Happens, Poison Help is Here for You. Here for you as in older adults as well. America's Poison Centers and the Poison Helpline serve everyone in the United States, especially vulnerable populations like older adults. The Poison Helpline number, just in case you don't know it, is 1-800-222-1222. Let me say that again. 1-800-222-1222. Program that number into your phone today if you haven't done so already, and share it with your patients and your colleagues. It is a very important phone number. It could save a life. America's Poison Centers and the Poison Helpline are valuable resources that are supported in part by federal funds. Thank you for all you do, Poison Centers and Poison Helpline workers. What you do matters. Thank you. At this time, let me tell you what's coming up during our interview. During our conversation, Angel and Wendy will define older adults. They will provide stats on United States poisonings in older adults, give examples of poisonings among older adults, discuss risk factors for poisonings in that age group, offer strategies to prevent poisonings in older adults, including promoting the Poison Helpline as a resource. They will also explain what pharmacists can do to help prevent poisonings in older adults, tell you when to call the Poison Helpline, and more. Without further ado, here's my conversation with Angel Bivens, RPH, and Dr. Wendy Stephan. Hi, Angel and Wendy. Welcome back to the Pharmacist's Voice podcast.
Hi, thanks for having us.
Well, it's my pleasure to have you. We are going to be talking about poison prevention in older adults. This is a topic that we have not isolated and focused on before. So as we get started, I want to ask Angel, how do we define older adults?
Different data sets will define older adults in different ways. So for the purposes of Poison Center data, we define an older adult as 60 and older.
And then in some of the other data sets, and in the public mind, they may think of 65 and older. So we'll be sharing data kind of from both two different sources. So we'll always try to indicate which we're referring to.
Right.
Thank you very much, ladies. I just realized that I did not give you a chance to introduce yourselves. I guess I'm figuring everybody knows you from my previous episodes. We have returning guests, Angel Bivens, RPH, and Dr. Wendy Stephan. Angel, could you introduce yourself, please?
Hi, yes. Thanks for having me. I am Angel Bivens. I am a pharmacist by training, and I am the managing director at the Maryland Poison Center.
Thank you. And Wendy?
Yeah, I'm Wendy Stephan, educator and epidemiologist at the Poison Control Center in South Florida, based in Miami. And my training is I have a doctorate in epidemiology and a master in public health.
Very good. Thank you both for returning to the podcast. I love talking to you guys. This is one of my favorite podcast episodes all year. I'm like a big Snow White fan with the poison apple and the antidote being love's true kiss and all that. I can't help it. I'm a big nerd. Disney fan, love a happy ending. And Wendy's showing me an apple. We're talking via Zoom today. Thank you very much. She's on Team Snow White too. I love it. All right, as we get started, let's talk about stats. What are the stats on United States poisonings in older adults? Angel, let's go to you first.
If we look back at data, actually older adults only account for about 9% of cases reported to poison centers. But the striking statistic is they account for about 32% of deaths. So that's why this is an important conversation to have, because older adults aren't big users of poison centers. And when we hear about the situations that they find themselves in, they tend to have worse outcomes than other age groups.
Thank you for sharing that. I know it's an unfortunate statistic, but I appreciate you sharing it nonetheless. Wendy, anything to add about that?
Yeah, so, as an epidemiologist, I'm really interested in the bad outcomes. When we talk about fatalities, like Angel just mentioned, nationwide in 2022, when we look at the population 60 and older, we recorded, CDC recorded 14,513 accidental drug poisoning deaths in that population. So it's a lot of people. And then I would also add, we have to consider the 1,522 drug poisoning deaths that were suicides in this population. So I think we have to be thinking about older adults for unintentional, but also intentional exposures to drugs and medications as a leading cause of injury death now for that population.
I would agree.
Thank you for sharing that. Yeah, percentages are one thing, but then assigning a number, the volume of people who are dying by poisoning or being injured by poisoning. That's remarkable. Thank you for sharing the stats. So I think we can all agree it is a problem, poisonings in older adults. Now that we've defined a little bit about the numbers and the stats, let's go to Wendy. Wendy, can you give me some examples of poisonings among older adults, please?
Sure. So again, the types of things we hear about at the Poison Center include, accidental poisonings, but also intentional. And I would say in terms of Florida data for our older 65, when I looked up the types of exposures, like what are they calling us for? It was all about medication, not surprisingly. So first being beta blockers. Second were benzodiazepines. Again, widely prescribed drugs, but people are struggling with them, right? They've made a mistake, they've taken too much, they've double dosed, they've taken a partner's. And then third was being the calcium antagonist. And so, these are again widely prescribed, and often it's just mistakes. The light was low, or they're traveling, and they reached for the wrong thing. So that's the type of things we hear about a lot.
I heard a lot of medications there, and that's not a surprise. And you said this is Florida specific data, correct?
Yes.
There are a number of older adults in Florida, if I'm not mistaken, right?
Right. Our population is older than the US on the average. I mean, not tremendously, but in general, yeah, we're older. We also have lower income. I know people think of Florida as being a wealthy state, but we do have our average, older person is not wealthy. So I think that goes to part of what we're dealing with.
Thanks for that information. Angel, would you like to add any other information, maybe Maryland or national data?
In Maryland, we tend to do broad categories. So, Wendy mentioned beta blockers and calcium antagonists. So cardiovascular meds in general is our number one for older adults. Pain relievers come in next, right? And in that category, that could be the over-the-counter, your acetaminophen, ibuprofens. But some of these folks are also on, the opioid pain relievers. So that's number two as far as a broad category. Surprisingly, hormones is number three, and that always it scratches my head. But when you're looking at Poison Center data, we include thyroid and anti-diabetic medications in that hormone category, right? Well, there you go. Now you understand why it's up there in one of the leading. So we help a lot of people with insulin mistakes. And again, these are just innocent mistakes. But calling the poison center for something like that can enable us to help them at home, not send them to the hospital. And then, the antidepressants and sedatives kind of round out our 4 and 5.
Thank you. And again, that's Maryland specific data, correct?
Yes, that's Maryland specific.
Thank you very much for your responses about Maryland and Florida. All right, now we've defined older adults. We've got some numbers, the stats. We've got the names of the offending agents, the items that are poisoning these older adults. We could go anywhere in this conversation, but what I think I want to talk about is what some of the risk factors are for poisonings in older adults. Wendy.
Yeah, so I guess first and foremost would just be that polypharmacy. Just that as people are getting older, living longer, they're taking a lot of medication and from a lot of different physicians, right? And I know we've talked about the danger of, everybody not knowing what everyone else is doing and assumptions on the patient part that physicians are coordinating, which may or may not be true. So certainly polypharmacy would be the first thing, particularly if they're at a lot of different facilities, right? If they're all within one health system, the chances of them picking up that, any conflicts or outdated medication is higher, but still not zero, I would say. And then I would say kidney and liver function changes. When we see poisonings in children, they are very resilient. They can recover. They can actually, regrow, damaged sections of liver. Older adults don't see that, right? So people with kidney and liver disease simply have more trouble excreting. And so that poison, whatever they've been exposed to, is going to circulate a little longer. So those would be the first two I sort of that come to mind.
I appreciate you bringing those up. And I think the sad part is some of these older adults don't know that they have had kidney and liver function changes. What else is on your list there, Wendy?
Obviously, in terms of behavioral risk, there are a few things. So first of all, we all come to old age having been young people who got away with a lot. And so I think we continue acting in certain ways that maybe our bodies can't handle. And not realizing, as you mentioned, that things maybe have changed. So issues like vision, you're just not seeing as much. So whatever system, worked for you, whether it was a pill minder or a Ziploc baggie or whatever, that worked great, but now you just don't see as well. So easier to make mistakes from a vision perspective. Also, I would say, dementia. Not everyone, obviously, who's getting older suffers from dementia, but we do have a subset of population who begin to struggle with memory. Did I take my medication already? So I think caregivers of people with dementia should definitely be aware that those folks shouldn't be necessarily in charge of their own meds.
Thank you for bringing up those risk factors. If you don't mind, I think I'll kick it over to Angel and see if you have anything to add.
Of course, I have something to add because the list is long. There's a lot of things that come into play with regard to medicine safety. Lack of a system to take medicines, right? Older adults typically are taking many medications, and they need to make sure that they have a system so that they know when they're supposed to take them and know that they have taken them. There's a lot of different ways that you can develop a system. Whatever works for you, write it down, have the pill minders that are separated by hour of the day. Just, find a system that works for you so that you can stay on track. But I think the biggest thing here that I'd like to point out, and it's a plug for poison centers, if something slides sideways, if you're in that, I can't remember if I took my medicine, that's the time you stop and you pick up the phone and you call the poison center, because there are some medicines that it's better to have a double dose on, and there are other medicines that it's worse to have that double dose. So in that case, we would want you to skip that medicine. So we're not going to tell you to take it. And that's something that varies from medicine to medicine. So that's something that poison centers can help with right off the bat. And then the last thing is just confusion with lookalike items, right? There's household products, just take Comet Cleanser and Parmesan cheese. You don't want to store those right next door to one another in your cabinet, right? Because both are useful, but you definitely don't want to put the Comet in the spaghetti sauce, and you definitely don't want to try to clean your tub with the Parmesan cheese. and it goes back to the vision changes. But more so right now, there are edible cannabis products that, if they're visiting someplace, they might think that there's chocolate on the counter and it might be cannabis chocolate. And so unbeknownst to them, they've just been exposed to THC.
Thank you for talking about all those risk factors. Is there anything else that you want to talk about risk factor wise with poisonings in older adults? I don't want to miss anything.
I had something sort of going back to the fact that some of these fatalities are self-harm. We are seeing higher rates of depression and anxiety and other mental illnesses in our older adults, not only in older adults, certainly. And some of the medications used to treat these conditions also are inherently dangerous. So, we do want to treat depression in older adults, not just assume that people get sad as they get older, because that is not necessarily the case. So people should act and get screened and be treated. But when someone has been prescribed medication, there does need to be some sort of safety plan in place. And that might be as simple as blister packing, their medications, or packing them, in one day at a time type administration, the system that Angel was mentioning. So I do think we need to be more proactive about caring for our older adults who are struggling with depression and anxiety, and that is protective for poisoning.
Thank you for talking about mental health issues being a risk factor for poisoning in older adults. That's so true.
We're not only keeping them safe from the medicines themselves, but the drug interactions, right? So we encourage older adults, we encourage all patients to have honest conversations with their doctors about all of the medicine that they're on. And that's all doctors, every appointment, what medicines are you on? Because some of those antidepressant type medicines could interact with some of the heart medicines and things like that. So it is really important to encourage older adults to be completely transparent with all healthcare providers that they interact with their pharmacist, with all physicians, to make sure that there's not going to be drug interactions. And kind of spinning off of that also is encouraging them to ask questions, right? There is some low health literacy in older adults. And we want to encourage them to ask questions and make sure that they understand why they're taking everything. If a doctor prescribes something new, we want them to ask the question, okay, you're prescribing this. Is there anything I'm supposed to stop? Because sometimes physicians might assume that they understand that they're replacing one for the other, and the patient misses that completely. So empowering older adults to ask questions, and maybe as pharmacists, we can step in and say, oh, they added this medicine. I wonder, are they supposed to be adding it, or are they supposed to be stopping something? And I think that's a great place that the pharmacist can step in and maybe help.
Unfortunately, as pharmacists, we have the curse of knowledge. We know too much. We forget what it's like to have that low health literacy. People who have never gone to college for anything medical, or they maybe have never been sick and needed medicine before, and they don't know, like you said, am I supposed to stop the old drug, or is this something that we're adding? It can be hard because as much as we can do to correct low health literacy, we also have the curse of knowledge working against us. I don't know what the solution for that is, but anyways, it is definitely a risk factor for poisonings in older adults to have low health literacy. Enough said there. Great list. If there's nothing else to add there, I think we'll move on to talking about what pharmacists can do to help. So let's move on to that. As a pharmacist, I'm going to pick on you first, Angel. What can we as pharmacists do to help our older adult patients avoid poisonings?
I think we pointed out some of them. The compliance packaging, the blister packs that Wendy mentioned, those can be good in so many ways. Number one, with the mental health and knowing what they're supposed to take and when, but also that means that it's kind of a cue. If the bubble is poked out, I know that I took it, right? As opposed to having just a bottle of pills. Use your smartphone as a timer to take medicines. Maybe, if you have to take something at 2:00 in the afternoon, well, I don't want you thinking that you can't go out and do something fun at 2:00 in the afternoon because you have to take your medicine. No, take your medicine with you, go out, do your fun thing, but set a timer on your phone to remind you, oh, wait, I have to take something at 2 o'clock.
I gotta say something about that real quick. My mom sets timers on her phone all the time, and then she forgets what the timer is for. So may I just say that if an older adult is going to set a timer on their phone, have them label it, like take your Zoloft, whatever it is, because I'm sure my mom, who God bless her, she's 75, she's a great lady, she's very smart, but she just can't remember everything all the time. Sometimes I'll set a timer at my house and she'll think she has set it for herself and she'll be like, "Oh man, what was that for?" or she'll tape a note to the microwave, near the timer. Anyways, I just want to say it's not an isolated incident with one single person in the United States. There's many, many older adults that set a timer and they do not know what it is for once the timer goes off. Thank you for letting me interject, Angel. Back to you.
Sure, no problem. So yeah, and the other thing would be like a medicine tracker or a medicine record that you can offer them that they can take to their doctor's offices. So there's nothing worse than going to a doctor's appointment and having them say, "Oh, what medicines are you currently taking?" Okay, if you have something pre-printed, this is what I'm taking. I don't want to sit there and write them all down here. This is what I'm taking. So I think pharmacists can help in that respect. If there is some way that you can go ahead and give them a printout of what they're currently taking that they can go ahead and use at medical appointments, I think that would be incredibly helpful.
Great information. Thank you so much, Angel. Wendy, I know that you probably have some ideas on this too. What can pharmacists do to help older adults avoid poisonings?
Well, this is something that actually comes from geriatrics, which I know pharmacists do, routinely with the, reconciliation process. But with patients, I love the idea of the brown bag system where, they do this sometimes in the ED as well. But when a geriatrician sees a patient for the first time, they ask them to bring everything they're taking for a health purpose in a brown bag. So that sweeps up things like teas and tinctures and cannabis gummies and anything that that person is taking with the prescriptions, current and not so current or whatever, and they dump them out in front of the provider. And I think this is something pharmacists can also do. Yes, you have an electronic health record, but is it capturing everything? Probably not, because as you mentioned, older adults are very vulnerable, I think, to misinformation and to hear, try this, it worked for me, type things from friends, family, and I would say even bad actors, something they've bought online, et cetera. So let's get the whole picture. And rather than a medication list, which requires record keeping and writing down of things, the brown bag method is just visual. So you just dump it out and then you can have that conversation. I know that that's not time friendly for most pharmacists, but it is an option for when someone is struggling, to say, you know what, let's do this when I have everything in front of me and look at the whole picture. This is an opportunity to catch those things that are interacting. Or catch things that are old and outdated, or the dosage is incorrect, or they didn't understand that they were supposed to be taking it at all, or whatever. So I would recommend the brown bag method.
Those are both good, having a list or the brown bag system, or maybe both, really. I think there's no wrong way to do it except for not doing it at all. It's better than nothing.
And there are bad systems. I mean, dear friend just mentioned, her father, basically that he was leaving medicines around the house so that he would visually see them and that he would remember them. And it was just basically sprinkled all through the house, but it was clearly not working. And then it was also a hazard for people who come to visit the home, right? So when grandchildren would come or teenagers visit the home, so that's a concern.
If I could interject another example of a bad system, pharmacists might not realize people were doing this. We had a situation where the system that the caller was using was they would take the empty prescription bottles and they would use that as their daily pill minder, right? So, they would have 7 prescription bottles sitting there with the incorrect label on it, and they would put their day's medicine in there. And in the morning, they would just wake up and swallow the whole bottle of pills. Well, one morning they grabbed the wrong bottle and swallowed a mouthful of their dog's thyroid medication. You may or may not know, but dogs take higher doses of thyroid medicine than people do. They require higher doses. And so this person was truly at risk for a thyroid storm, and we had to manage them in the hospital. So definitely a kind of off the wall system. But again, pharmacists, ask your older adults, what medicine reminder system are you using so that you can maybe avoid something like that? Say, okay, well, that might not be the best idea. How about if we do this, and come up with another suggestion for them?
And disposal should be part of the plan. That's the other thing I think, particularly older adults. My grandmother lived through the Depression and she kept everything, margarine containers and the stubs of pencils and things. And so I think there is a generational difference in terms of everything is kept just in case you need it. And then you get this stockpile that is potentially harmful to them, but also family members and even at risk for crime, right? People are breaking into homes looking for pain medicines, looking for these valuable drugs. So I think we have more options for disposal now, right? So a lot of our retail pharmacy settings now have drop-off boxes, which is a really wonderful improvement and a recent improvement. But also communities and sheriff's offices and police departments also offer either, events or standing take back programs that people really should take advantage of, because keeping medicine forever is not really safe. It's not safe. And it's also not useful, right? The medicine expires after a certain point. It's not even doing any good. It's breaking down chemically. So we really want people to have it be a cycle. Bring the new stuff in that is current, get rid of the old stuff. So it's just easier to keep track of.
Well said. I'm a big proponent of drug take-back days and drug take-back programs. Of course, it'd be nice if people got rid of stuff year-round, but some people need a call to action. So those drug take-back days twice a year are great calls to action, usually in October and April. All right, we had a planning meeting back in January, I think it was, and I took some notes, and there were a few things that we talked about then that haven't come up now. So I'm just going to run through a few of those real quick. We were talking about how older adults sometimes live in smaller spaces, the downsize, right? They sell their house in Ohio, they move to Florida, they get their retirement home, right? So let's talk to Wendy. Wendy, when somebody they downsize from that 4-bedroom, 2.5-bathroom house down to their 2-bedroom condo, what could go wrong with medications or, poisoning?
Well, the good news is they don't have as much room to stockpile. There is a potential upside, and there are a lot of benefits actually for moving for older adults in terms of their mental, cognitive stimulation, whatever, having to learn new programs and new pathways, and so it can be a very positive thing. The less positive thing is if you're used to having a lot of space and now you're jammed into a smaller space and your closets and things, and you haven't gotten rid of a lot of stuff, you can see medications and foods and poisons stored in the same place. So if that happens, you do run the risk of these look-alike poisonings that are, again, the risk is higher because of vision or cognitive issues, confusion, and again, new space, new patterns, disruption of routine that can actually be a risk factor for making that type of mistake. So I would think that one is going to be one of the issues you might see.
Absolutely. And as pharmacists, I think we can suggest things like that. Oh, welcome to our store, welcome to Florida. I just wanted to let you know that, maybe there's these best practices. Pretty poisons are a great topic. I love that you brought that up. I think Angel talked about that earlier with the Comet cleanser and the Parmesan cheese. That's a classic example. It makes me cringe when I think about it because it's so probable that it could happen. But, just talking to older adults, if you have a chance, whether it's doing your MTM sessions or maybe you're at a health fair, maybe you do some volunteering. Talk to those older adults about, hey, while you're in your new space, keep the two things separate, cleaning products and medications. It's a great opportunity to start a conversation.
And I love the idea of the medicine safe. I know that people tend to think about, poison safety and locks and whatever for situations where there are children. But I like a medicine safe, for everyone, because I think it makes a bright line between, a handful of gummy bears, that is just sugar versus something that is potentially problematic if you have too much. So having a medicine safe where maybe there's one person who has charge of the medication in the home. It's just a bright line between things that we have to take extra caution with versus things that, we can eat by the handful. So I'm encouraging more people to have medicine safes, even if they don't have small children. And I just think that's a nice, useful tip. So I bring that out to my events now.
Yeah, I love to containerize things. And I feel like that's what we're talking about here. When you talk about medication safes, it's got its own container that it belongs in. And if it belongs in that container, it's much less likely to get confused with some sort of a household cleaner. Anything to add to that, Angel?
It's tough whenever you downsize. I think the other thing with relocating though is what are they doing? They have to find new healthcare providers. And this is where Wendy's suggestion of brown bag. And I think as pharmacists, we also have to remind people that anything you take, and Wendy, I forgive me, I forget exactly how you termed it, but it was perfect. Anything you take to treat something. So that makes it wide open. So vitamins and supplements and over-the-counter medicines and prescription medicines and cannabis products. Everything that you're taking needs to be in that bag, but that is a prime time for the brown bag to come into play. Is at your new doctor visits, and even if you're starting up with a new pharmacy. Like, look, this is all the stuff I'm taking. Is there anything that is interacting? Just to get that second opinion.
Definitely. And Angel, I'm going to pick on you here for a second since you're the other pharmacist here in the conversation. What if a patient is unaware that they've got these kidney or these liver function problems, but we as a pharmacist are seeing something that's wrong? What should we be saying to patients who have medications who might be renally dosed or hepatically dosed?
The best thing is if you have that opportunity to counsel whenever they're picking up, if you know it's something that's renally excreted or hepatically metabolized, right? Maybe say to them, hey, when was the last time you had your blood work done? It's really important to do those blood tests when the doctor orders them. And we do know, and I add that to my list of risk factors whenever talking about older adults, is that sometimes it's hard for them to get to the lab, right? It might be, it's just another appointment. It's something they have to get a ride for, or it's inconvenient, or sometimes it's not covered by insurance and there might be a cost associated with it. So we need to encourage them that this is part of their health care, that they need to follow through on the labs because there's really no outward signs if your kidneys or your liver start to decrease in their function. But when that happens, meds can build up. Digoxin is probably the biggest. Digoxin and lithium are probably two of the biggest that will build up when the kidneys start to fail. And a lot of times that's the reason for our DIG patients showing up in emergency departments is because it was just undiagnosed, renal failure or decreased kidney function.
Thank you for talking about that. Yeah, I feel like as the medication expert on the healthcare team, pharmacists have an opportunity to ask patients for their lab work or remind them that you should be getting that because you're on a medication that needs to be monitored. Kidney and liver function need to be monitored. On the topic of what pharmacists can do to help, anybody else have anything else they would like to say about that?
I would just jump in about the issue of alcohol consumption. Are we talking to patients about, how much alcohol is being combined with these medications? We've seen an increase in alcohol consumption, particularly in women, but also in older adults and post-pandemic. So I think asking about it, so that you can make adjustments or recognize potential risks. We had a very interesting call a while ago where an elderly lady, she was actually in her 90s, very active. She had been out all day, apparently, and then instead of taking her medicine spread out as she normally did, she had taken everything right before bed and had thought better of it, right, and given us a call. And so we were able to evaluate, It wasn't great that they were all combined, but our poison specialist was able to run some calculations and determine that she was okay. But after he got off the phone with her, he did mention to me, he said she was one glass of wine away from a toxic exposure. And so I don't think people realize how little it would take, when combined with some other central nervous system depressants, to see really harmful effects from alcohol.
I think as pharmacists, we rely on the fact that we put the warning stickers on, right? As far as do not take with alcohol, take with food, etc. And that's kind of passive, and we rely on the patient actually reading those things. And quite frankly, I don't look at those stickers anymore. But then I'm a pharmacist, so so I have some of the knowledge. But I really do think that folks don't necessarily look at those as closely as they should. It's great as a reminder so that they can remember if they forget. But I think as a pharmacist, you want to go ahead when you're dispensing a medicine to them.
And we have to consider people also who have alcohol use disorder.
Yes.
It's not optional for them to stop drinking.
Correct.
Right? They cannot just stop because they've started a new medication. So having a sense of that being an ongoing health problem for them, helps you be a better provider, right? That you're not putting them at risk by giving them something that they can't comply with the safety guidance.
Exactly. So have that conversation at that point of dispensing rather than relying on the sticker, and say, is this going to be a problem? Or do we need to call the doctor and try to get a different medication or work with you in some way? So I do. I think this is a great intervention.
Same thing for opioid use disorder, right?
Absolutely.
It is less common in our older adults, but it is something to mention, right? If that's an ongoing situation, let's not, or even put their recovery at risk, right? These are questions that are very, very important to be asking.
And we have to remember that older adults are very private. They might feel that if I admit that I have wine, that the doctor's going to judge me, or if I admit that I have substance use disorder, they're going to think differently of me. And I think that again, as healthcare providers, our main goal is to make all of our interactions a safe space, right? No judgment. Ask the questions and say, okay, that's great. Thank you for being honest. Let's see how we can work with this.
There's definitely that opportunity to counsel. Definitely. Alcohol use, just getting that information or taking it into account when we're thinking about the medications that have already been taken. I loved your story, Wendy, when you're saying that person was one glass away from being poisoned. That is impactful. I'm going to just blow through 3 quick comments and I'll open it up for discussion and then we can move on. While we were planning, we had also thought about medication management by a family member, having caregivers come in weekly. So as pharmacists, we can suggest if we're noticing compliance issues, late refills, or, not getting the clinical outcomes that were intended, we can suggest that the medications be managed by a family member or a caregiver. My second point here is we can print off a medication administration record or a MAR, something that's very simple. It doesn't have to be complicated, but just what is the name of the medication? When is it taken? And maybe have little check boxes. Yes, I know that this would possibly be something that we would have to do on our own time, but it is something that as pharmacists we're able to do. And perhaps we could monetize it too, charge for our time. Just saying, I always think like an entrepreneur. And also, we need to think about putting the meds where they're going to be seen. I think, Angel, you had talked about having those bubble packaged medications, or you have an entire day's worth of medications in one pack. Putting that where somebody can see it and reach it is really important. And may I suggest putting the medication administration record right next to the bubble packed medications? I think, putting multiple strategies together could be really effective. And as pharmacists, we could be recommending some of those strategies, especially when we see that things aren't going quite as well as they should be. Angel, anything to add to that?
That's all great ideas. The one thing that we're missing here is these are all perfect if older adults are living alone. Some of these strategies really aren't going to be a good idea if there are young children that are going to be visiting the home, right? So we don't want things out in the open if the grandkids are coming over. And the daily pill minders, or the medications in the bottles without the safety closure. So if you are still an older adult whose young grandchildren come over to visit, by all means, you're going to have to take the time to make sure stuff is out of sight and unreachable by the kids. But if you are living alone, if there are no young children in your home, all of these strategies are wonderful just to go ahead and get the older adults to be compliant.
I love how you talked about what could go wrong, because I think, yes, that's right. Some people that suggest these strategies don't take into account that there may be visitors. Thank you for bringing that to my audience's attention. Wendy, anything that you would like to follow up on?
I would just say, I think we're almost a victim of our own success in the sense that poison centers are associated with pediatrics, right? And it is the poison helpline, and people think of poisons as being household chemicals, and they picture the small child. And I think I almost want people to think of it as the medicine safety line because medications and drugs now are the driver for serious poisonings and fatal poisonings in the United States. And I think older adults understand that because of the medicine they take, they are at risk. But they don't connect that risk with our service. So I guess that's the biggest thing is we are there for everyone. When you are not sure about a medication and you didn't ask your pharmacist and you're there alone at home, or you inject the insulin, incorrectly or again or too late or whatever. The Poison Control Center is there to walk you through with a live person, which I think older adults really value the phone service in a way that our younger adults are shying away from. So this is a great opportunity to talk to somebody who is nice and knowledgeable and awake at midnight.
Yes, 24/7, right? Angel, any follow-up before I move on?
I think that's a great segue, Wendy, into reminding your audience, Kim, who answers the phones at the Poison Center? We're pharmacists and nurses, right? And so that usually will take the older adult to, oh, I'm not going to call them, they're just volunteers, to, oh, wait, I'm going to talk to a healthcare professional. Absolutely, give us a call because we do have that knowledge. We are going to help them. We are going to be able to give them good advice. So I would ask your audience that's one of the things. If you're talking about the Poison Center, promote the fact that it's a pharmacist like them that could be answering the phone. It's a nurse. Some places have physicians that are answering the phones.
Yeah, we're almost all physicians. Yeah, in Miami, we have one pharmacist now, though we're very excited about our recent addition of a pharmacist.
So you're going to talk to a healthcare professional, and that should be encouragement enough to get them to call.
Great point, Angel. I think sometimes the messenger is important. When a pharmacist gives that permission, this is who you need to call. It's okay to call. Sometimes it makes it more likely for them to call. The messenger is important.
Well, one of the things that we say out in the community when we do programs, especially for older adults, it's like, do you understand that doctors in the emergency room and paramedics out, dealing with a patient on scene, call the Poison Center for help? Okay, so if doctors can call us and ask us questions, certainly you can call us and ask us questions because, like Wendy said, we are friendly, we are judgment-free, we just want to help.
Absolutely. Angel, what is the poison helpline number? I feel like we can't say it enough. Go ahead.
1-800-222-1222.
Awesome. Thank you so much. And let's go to Wendy. Wendy, when's the best time for an older adult to call the poison helpline if they think they're in trouble?
Well, ideally, we're there before they think they're in trouble, right? So I know people have a lot of questions and anxieties about medication and fears, right? We can talk to people who know they're taking a lot of medication and they know that they're at risk of making mistakes or falling, subject to an adverse reaction or a side effect or whatever. So we're there sort of early in the process to answer questions. And that would be for things like, I'm taking a blood pressure medicine and I actually have a cough. I'm going to start a cough syrup that I got at the drugstore, just over the counter. Do these two play nicely together? I didn't think about that. And the answer is probably no. right? Because a lot of over-the-counter products do conflict with their particular prescription. So that's one way to sort of get ahead of a potential poisoning, is to call for questions. But then I would also say, call when you realize you've done something that you hadn't thought about, or you realize you've double dosed. So again, my friend whose father had the medicine around the house, she said, "Oh, I have to take my medicine," and then said, "Oh, actually, now I realize I already did." And now then he was frightened. And so that I said, that would have been a perfect time to call the Poison Control Center. She said, "Yeah, he got really dizzy and it was scary." And it's like, yeah, so even if they don't need to go into the hospital, which is often not the case. They may need to, for instance, stay with someone else. They may be counseled, don't drive, don't go for a walk. You are going to be a little unsteady for a few hours, right? That's very concrete, specific guidance for their situation. It doesn't always require a trip to the hospital. So this can be a big savings and a big stress reliever.
Yeah, prevention rather than treatment. I feel like you're saying call before you act, basically, right?
Yeah, ideally, right? But of course, that's not always possible.
I want to stress a little bit more what Wendy was saying there. Calling us doesn't mean we're going to recommend that you go into a healthcare facility, right? Calling us just means you're acknowledging that this happened, and we're going to tell you what to look for. And a lot of poison centers will follow up to make sure that you're doing okay. So it's a great resource because it's not just a one call and done. If we feel that we want to check on you, that we need to check on you, then we're going to do that. And we're going to invite you to call us back if you're feeling something that we didn't describe to you, right? We're going to say, okay, these are the things you're going to watch for, and it should happen within this period of time. And if something different happens, I want you to call me back, right? So we have that ongoing conversation. So it's not just you call us and then we forget you and we move on to the next caller. We want to be part of the management.
Thank you for talking about that. And speaking of management, as a pharmacist, we like to, refill prescriptions, right? People come to us in the retail environment. We refill their prescriptions. We have a relationship with them. We tell them take one by mouth every day, and so on and so forth. And hopefully, patients are taking their medications as prescribed and they know how they feel when everything's all right and it feels normal. And Wendy was talking about somebody feeling what was it, dizzy or, not feeling right, right? They know what it feels like when something has gone wrong. So I think as pharmacists, we have the opportunity to counsel on taking your medications consistently so you know what you feel like when things are going right. But then when things are going wrong, then they really know what that is. And we can talk to them about that's when you call the poison helpline if the pharmacy is not open and the person with whom you already have this relationship with is unavailable. Anybody want to add anything to that?
For our most serious poisonings, waiting for symptoms can be a problem, right? So if you recognize that you've done something unusual, right? That you have taken the dog's medicine, right? You're going to call right away, right? I know sometimes it can take a while, but I do think better to get ahead of it because poison centers have a lot of tools at their disposal to essentially block absorption, address metabolites, or things that really prevent harm totally. What is harder for us is when we get a call when everything has already gone haywire. You've got multi-system involvement. It's a Hail Mary. And then the provider's like, gosh, the poison center wasn't able to help very much. Well, the patient was dying, right? At that point, the options for management are, slim to none. And so I would just say, if you know something weird has happened, call immediately.
I like that tagline. That should be an Instagram post. If you know something weird has happened, call immediately. Perfect.
Also, we can put your mind at ease, right? If you know that you took something in the wrong way, don't sit there and worry and wait and say, what should I have done? Why did I do that? What's going to happen to me? We can alleviate that worry. Call us, let us know what you did. And oftentimes we can say, this is not going to be a problem, or you're just going to get mildly sleepy. It's going to be fine. So we offer that reassurance, and we will let you know when you need to worry. Okay, so we'll tell you when to worry. You don't have to sit there and worry. If you call us right away, we can help with that.
And I would say with older adults that the symptoms of anxiety can be really dangerous. I mean, that it can be almost more harmful than the actual toxicology, right? The fear, the anxiety, blood pressure goes up, heart rate goes up. You've got somebody with a cardiac situation, and now this person is really at risk. And so I would not underestimate the power of reassurance, and being told you're going to be fine. A person saying that to you, that is just it's really gold for the older adult, particularly everybody, but also for older adults.
Yes, I know that the poison helpline can be a calming force. I love using my voice, right? And I feel like as a pharmacist, we have the opportunity to use our voices to calm people down and point them in the right direction. And if we're not the right voice, we can refer people to the poison helpline. Yep. And you guys can be that reassuring voice to them. As we start to wind down this episode, this is like my favorite conversation all year. I love the poison prevention episode. But just as kind of like a bonus question, we didn't get to this during our planning meeting, but I would love to hear some myths and misconceptions that you've heard from older adults as they've called the poison helpline. What do they believe about medications that can get them into trouble? They probably have some myths and misconceptions. Wendy, let's start with you.
Well, we hear from everyone that milk can, essentially neutralize poisons. I wouldn't say that's only older adults, but that is one of a bunch of sort of DIY management strategies that we might encounter. And it does seem that older adults tend to have more of those sort of DIY approaches sort of up their sleeve, right? And that might be because, growing up, there wasn't a poison center to call. There wasn't a provider, around the corner. And so people had to do the best they could, right? So we will see this or hear this on the phones where they'll be in the background, da la leche, right? It's the grandmother saying, give the milk in Spanish. I think that can be a problem.
If I could add on to the milk in Florida, you're giving the milk to neutralize. Up here in Maryland, we've had people say, "I gave them milk to make them vomit." I'm like, why? I don't understand that connection.
It's conflating a few different strategies.
It's like, wait, did you think they were going to vomit when you put milk on their cereal? Like, what is the connection here? So yes, milk has many different myths associated with it.
Thank you for sharing that. I know we had a whole entire episode once upon a time of myths and misconceptions, but specifically related to older adults. I didn't know if there was anything that you had heard of. For example, like older adults might think that they can share medications because if it worked for me, it might work for you. Maybe they carry them around in case there's somebody that they can, push them off onto, or maybe they want to take something until it's gone, or somebody gave it to them, so they feel like they have to use it up. I mean, what have you heard?
That's not really
all
a
of
myth,
the
though.
above.
That's a reality. They do that. They absolutely do that because when we call and we say, we ask them, is this your medicine? Oh, no, the lady down the hall gave it to me because it worked for her. So I wouldn't even consider that a myth. That's a reality for poison specialists, that they actually do share medicines. And we try, when we're doing education for older adults, we say, no, you can't do that.
And it comes from a spirit of helping. I do understand that's also cultural. Like, maybe you don't have access to a doctor. Maybe we're all doing the best we can, so that sharing I know comes from a good place of wanting to help, but the harms can be very substantial, whether there's an allergy involved or a sensitivity or a contraindication. How would you know? You don't. But I don't think that's unique to the older adult population. But I think poverty is part of that picture, but also sort of a cultural desire to help people who are similar to you or who are at disadvantage. I think that definitely drives that.
Absolutely, because their heart is in the right place. But we need to discourage that because it can be dangerous. And I think that one of the biggest myths surrounding poison centers with older adults is that older adults just plain and simple say they don't need the poison center because I don't have any little kids in the house. This happens to us at health fairs all the time. Older adults will be trying to zip by our table. And we're like, wait, stop. Well, I don't need you. I don't have any kids in the house. You do need us, right? We're here to help with medicines. We're here to help with household products. We've had people stop at the table and say, well, I don't take medicine, so I still don't need you. Oh, but you probably use cleaning products. You probably have a fire extinguisher. We can help with all kinds of things, stuff in your eye, stuff, fumes that are created that you're breathing. So everybody, going back to what Wendy said, everybody needs the poison center. And older adults are ones that are a little harder to convince. But hopefully after hearing Wendy and I speak today, your audience will say, okay, I'm going to promote the poison center to my older adult patients because there is a whole lot of stuff that they can help with.
There's also some fatalism, I feel like, with older adults. Like, they're noticing that things are more difficult. Like, it's harder to remember things. I see with my own parents, they're just like, I used to be able to do this with no trouble, and now things are confusing, and I have forgotten to do things, and I am, I have more medicines to manage that they get discouraged, right? And so I think a new resource is sometimes hard to incorporate, even if it is phone and even if they get good results. So I think we need to fight against that. We can teach people, new strategies, and offer new resources, and this would be one of them.
Absolutely. Thank you for those comments. And going back to counseling patients on drug disposal, I think talking about what you just said about people, their heart's in the right place, trying to help somebody else. But when we talk about drug disposal, I think we need to talk about it's okay to let this go because you're not to share this with someone else. You would think that you don't have to say something like that, but unfortunately, it is something that needs to be said.
There's also, with drug disposal, an environmental concern that I've encountered with older adults. They're hesitant to dispose of it because they think it's going to end up in the environment and in our drinking water, because the old recommendations focus on flushing, right? But the new recommendations and the drug take back programs now incinerate. So we're, obviously there's no ideal drug disposal strategy, but it is not going into the drinking water when you participate in these established programs. So that I have had to provide that reassurance to folks.
Thank you for sharing that. I think the average pharmacist, believe it or not, does not know that incineration is the way that the drug take back collections are destroyed. I didn't find that out until I started kind of helping with the local drug addiction task force here in Wood County, Ohio. I was surprised. I had no idea that like steel mills were offering their flames, let's say, to incinerate things. But yeah, there you go. Yeah, you would think that these things don't need to be said, but thank you for bringing up the fact that they are incinerated. They're not just flushed into the lake. All right, as we start to wrap this up, let's go to kind of like a final round. I'd like to give you both an opportunity to share your biggest takeaway for my audience about poison prevention in older adults. Angel, let's start with you.
I would love it if your entire audience would promote the services of the Poison Center to older adults, all patients. And I would love if they would reach out to their local Poison Center and ask for stickers, magnets, educational materials to help emphasize the importance and encourage folks to save the phone number in their phones.
Great point. Thank you, Angel. Wendy.
Yeah, and as a special observation for National Poison Prevention Week, I would encourage you to actually, with your patients, your clients, save the number for the poison helpline into their phones, right? Most people do now have phones that have contacts, a contact list. And I find that's easier for people that it's already in their contact. They can search poison, it pops right up. They don't have to look for it online. It's a single touch. I know, when we're frightened or something's gone wrong, your hands shake. It is a lot of numbers. So that 1-800-222-1222, it's, I have dreams in which I can't get it dialed in fast enough. So it is a strategy for changing behavior in older adults. it's something concrete you can do. It's something, if you're having an event, that you can count how many people did that with you. And they're leaving your table with a resource, not that they'll have to remember, but it's already in their hands. So I think that goes a long way to increasing the chances that they'll utilize the service.
Yeah, I think you both kind of gave a similar answer. Program the phone number into your phone. The Poison Helpline is a resource. That's what I hear you both saying. Well, this has been a great discussion. I don't know what we're going to talk about next year, but I look forward to it already. Thank you so much for being here again on the Pharmacist's Voice podcast. Take care, ladies.
Thank you.
Thanks so much, Kim.
You're welcome. Thanks again to Dr. Wendy Stephan and Angel Bivens, RPH, for being my guests again on the Pharmacist's Voice podcast. This has been episode 321. Poison prevention in older adults does not get a lot of attention, so I hope that today's podcast episode was helpful to you. If nothing else, please program that Poison Helpline phone number into your phone. Do that today, share it with others, and use it when you need to. The number again is 1-800-222-1222. To find the show notes for this episode, go to thepharmacistvoice.com, click the podcast tab, and then search for episode 321. In those show notes, you will find the Poison Helpline number, Wendy's bio and social media links, Angel's bio and social media links to our other poison prevention podcast episodes, which I absolutely love. These are some of my favorite episodes. You will also find my social media links in the show notes and more. There are always a ton of links in my show notes. Please feel free to read them and explore. Everything you need is on thepharmacistvoice.com. As we wrap this episode up, do me a favor. If you know another pharmacist, technician, student, professor, anyone who would benefit from hearing this episode, please share it with them. And if you like this podcast, we've got a lot more coming up in 2025. Please subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thank you so much for listening today. Maybe you'll go out and save a life because of this episode. Again, thank you for listening. I'll talk to you next week.